This next exercise is to improve the flexibility and strength of the hip in the movement of what we term internal rotation. That movement is very frequently the first one to diminish when we have hip joint arthritis or hip joint injury. To begin with, we want to have a chair that we can face up against and stabilize for. And we'll start on our knees. I would suggest using some sort of a knee cushion, and then we'll drop down, come right up against the front edge of a chair with your hips and pelvis so that we can stabilize the pelvis movement. We don't want to be rotating the upper body. We want to just be using the hips. So we'll start with the knees and the ankles together, and the movement looks like this, wherein we drag the toe along the floor, rotating the lower leg outward as far as we can without creating any upper body or pelvic twist. We'd like it to be just from the hip joint We'd like to force the lower leg out as far as we can move it. And we can do both at the same time. I suggest doing that roughly 15 movements outward of each leg, or at least the involved leg. And be sure to keep your hips and pelvis up against the front edge of the chair so that we don't twist the upper body and give the illusion that we're getting more flexibility than we really are. So once again, stabilize against the chair, lower leg and toe drag along the floor in the outward direction of lower leg movement. Try to make that as far as you can take it under your own muscular effort. And that's the exercise.